Hi, good morning and good afternoon to all our lupus and fibromyalgia friends. We are live and I'm excited to have our special guest Kristal joining us today. We're just going to do some quick intros and then we'll begin with the interview. I'm Melissa Talwar from the Support Fibromyalgia Network, joined by Looms for Lupus.
Hi, good morning. Yes. Hi, good morning. I'm Estela Mata. I'm one of the co-founders of Looms for Lupus, a nonprofit organization that provides support to those living with lupus and overlapping conditions such as fibromyalgia, their loved ones and caregivers. And I'm so excited to have Kristal on with us today.
Kristal, why don't you give us a brief introduction? I'm over the moon and thrilled to have you back on for an interview.
Oh, you're so sweet. Thank you. I'm not that big of a deal, but I appreciate it. I'm excited to be here. I love you both very much. And I have mad love for all the advocacy and awareness work you're doing for not just your respective communities, but other communities as well. So I'm Kristal and the founder of the Fibromyalgia Pain Chronicles and Veteran Voices for Fibromyalgia, and focus on a lot of education and awareness for the fibromyalgia community. Teaching people how to advocate for their healthcare rights, along with do a lot of some policy and legislative advocacy as well.
That's fantastic. I know. And thank you again for your service, for being a veteran. We posted your story from Creaky Joints, which I was excited to see. So I definitely need to reshare that for everyone as well, because we had Veterans Day this week, and I know you've been sharing other organizations to highlight them. So it's been just an amazing experience to connect and get to know you much better. I know with some of our conversations that we've had with Estela and Juana recently, we've just been talking about mental health, physical health in our communities. What have you noticed either from the veteran community or the chronic illness community this year when it comes to just managing health overall with COVID?
Well, it's kind of up in the air. So on the veteran side of things, I don't know. There's the yay camp and the nay camp. Veteran community is very interesting because a lot of veterans have like multiple medical conditions and many have PTSD. So there's many with PTSD or anxiety disorders who are kind of like, I'm loving the telehealth because going to appointments physically, they endure a lot of stress. It could trigger their PTSD. And so in that essence, for some, they find it easier and are actually engaging more in healthcare and mental health care than they were before the pandemic. However, on the other side, we have a lot of veterans that they have specialized medical conditions that you don't typically see in the general population, like Gulf War illness, exposure to burn pits, if they served in like Iraq and Afghanistan. And a lot of, I know my VA, they're not seeing veterans face to face unless if they consider it an essential appointment. And then that has a lot of veterans not happy. And I know from my own personal experience is just to backtrack, in almost a year ago, December of 2019, I had major surgery, neurosurgery on my neck to fix some of the injuries I sustained while serving. And the time frame of healing fully is 12 to 18 months for the surgery I had. So I'm not even at the 12-month mark. And then 6 months after the surgery in June, I was at a red light. I was rear-ended and I sustained whiplash, concussion, all this great stuff. And so I had to go to the emergency room, and I was able to get in with my primary care doctor at the VA because I was in the ER. And that was like 3 days after the accident. And she determined I needed physical therapy, but that the VA would not provide it face to face. It would be telehealth. And I'm like, but there's things they're going to have to do that I can't do to myself. And this would be considered an essential appointment since I had this major surgery. I'm not fully healed. We got to make sure the plates aren't shifting in my neck. And they wouldn't schedule it. So I had to go to Cleveland Clinic for physical therapy. So there are these instances where veterans should be being seen, but they're using the whole essential appointment only. And there's a lot of circumstances that veterans are frustrated with. They're like, they feel their appointment is essential, or it really is essential. You can't get lab work done via telehealth. So it's a mix where there's certain areas of healthcare that they're embracing, but when they feel it's something essential, they're having a hard time getting an actual in-person appointment. So, and that's what we're dealing with now. And my understanding is for some departments at the VA healthcare system, they're projected not to open fully until spring of 2021.
Oh, wow. I mean, that's a long time. And I know Estella and Juana have been on conversations like this for telehealth. I mean, have you heard anything with the veterans is anyone talking about this from your experience, Estella?
No, you know what? There were conversations we had, we had a couple of meetings in regards to telehealth. So the one thing that we do know is that for some mental health, meetings or appointments, that's being done via telehealth. The providers should be getting reimbursed for telehealth visits. So there shouldn't be a problem, but I can see what Kristal's point is when it comes to there are essential visits. There are types of visits where you physically have to go in. And I think that it shouldn't be denied, especially when you've had surgery, when you have to be seen in person. I think we need to be more accommodating and listening to the patients more because, when you have situations like yours, Kristal, I think it's great to advocate for yourself and say, you know what, I do need to be seen. And if you can't see me, then let me go where I can be seen because you need to have that in-person visit. For myself, I had very bad sciatica and also I have 2 herniated discs. So I did a telemedicine appointment and it worked fantastic, except for the part where he told me, can you walk on your heels? And I thought, let me go get my heels from my room, right? But that's another story. But I had to go in to a physical appointment so he can then assess me completely and, and do everything else. But, besides that, I think it's very important for you as a patient to know that you do have to advocate for yourself and say, you know what, this can't be done via telemedicine. I need to be seen. And hopefully the provider understands and sees you, and then obviously use all the precautions necessary, with the, staying 6 feet apart and your face mask or whatever covering you need to have, whether it's a full face covering or just a face mask. But, I think again, the power to the patient and also to continue to advocate for yourself because there are things that need to be done in person.
Are these conversations happening, Kristal, from what you notice at patient conferences? Because I'm getting a lot of email newsletters for us to participate, but I'm wondering if you're able to join or if you've been a part of any of these discussions. Oh no,
So I gotta figure out how to answer that aesthetically. I actually have a couple of videos coming out on these topics. So here's the thing. I've been involved. I shouldn't even say involved, but I've attended several virtual healthcare conferences. And what I'm finding is that I am just a spectator, and that a lot of virtual conference not like connected where you can actually come on and ask a question like via video. They'll have sections where you could like a chat that you could put your question in or information, but it's not guaranteed they're going to read it, much less answers. So I feel that with the COVID pandemic, it's opened a lot of doors for patients and patient advocates to attend conferences that would normally we would not be able to in person because it'd be too expensive. However, I'm seeing that we're still not being involved equal level. Like we're just there as a viewer versus an active participant. And that's just a whole nother can of worms I'm working on. But with the, and that's both on just the regular FM community side and then on the veteran side. So for me, I'll sit there, I sign up to listen in on like my state representatives, representatives, hall conference calls and meetings, just to see where they're at with addressing healthcare needs for everyone. And I also was involved with conference calls pertaining to what they call compensation and pension for veterans. And it's a process if a veteran applies for a service-connected condition, and they are assessed, and those appointments have always been done in person. And the outcome of those appointments can determine, especially those who are just coming out of service, it can determine if they receive basically compensation is like disability pay from the VA and healthcare, and at what there's different percentages you're rated at based on your injuries. And if you're below like 50%, you can have co-pays, and above 50%, they're waived. And I was advocating that these need to be done in person because they're essential, because the outcome can, determine a veteran's ability to be financially stable, to have access to healthcare, whether or not it'll change the status that they have to pay for co-pays or not. So a lot of advocating for months on that, and they finally did move. Now this is interesting. So compensation and pension assessment exams are now in person, right? But yet not all medical health appointments for veterans are in person. Yet other facilities in the private healthcare are open, like the Cleveland Clinic out by me, Metro Health, University Hospitals, to name a few. So, I mean, it's a difficult topic because whether veterans realize it or not, the CDC has classified veterans as a high-risk group, especially if you're a Vietnam veteran exposed to Agent Orange, if you served at Camp Lejeune, if you have Gulf War illness, if you served in Iraq or Afghanistan, you're exposed to burn pits, they're all considered high risk. And if you have medical conditions such as like fibromyalgia, lupus, rheumatoid arthritis, of course you're higher risk. But the CDC hasn't been very vocal, and the VA has not been very vocal in educating veterans like, yes, you are higher risk, and not just because of age, but because of all these factors. So there's still a disconnect of information going out, and we're seeing more accessibility in the private healthcare sector than the VA right now. And I know it's both positive and negative. Like I said earlier, some people have to go in and be seen. They should be considered essential appointments. Some appointments, like as Estella was talking about for her sciatic nerve, do it telehealth. And it's really, I don't know, the VA is a huge system that's government run. So it's hard to kind of bring everybody, whether in conferences, town hall meetings, on the same page, and everybody having an equal voice. And a lot of times, like I said, in conferences and these town hall meetings, we're not always given the opportunity to express an idea, concern, or opinion. So,
well, I'm so glad we're having this. I'm glad we're having this topic, because I know I've done work with you for the Veteran Voices for Fibromyalgia, and I've seen how complicated it is. And that's why it's so important we're talking about this, because I've noticed that it's been missing from some of the conversations as well. I mean, we're part of the Mental Health Consortium, so they have some of the veteran organizations involved. But, from a chronic illness standpoint, we definitely need voices. And I'm going to get off a little off topic here, but to be honest, I was a little disappointed that some of the companies who sort of back patients this past week weren't really sharing a lot of that, because I was truly inspired by, I was seeing a lot of chronic illness, people sharing that they had been enlisted and they were veterans. And I saw the pictures change, especially from women in MS, fibromyalgia. And I was really impressed. I was just floored. I was like, this needs to be like really amplified much more. So we need to get more of your voice involved with these conversations, right, for sure.
Well, the other thing about, private healthcare, this is what people don't understand, is based on what stats you read, there's anywhere between 18.2 to 20 million veterans in the U.S., okay? And 2 million are women veterans. And the thing of it is on an annual basis, the VA only serves 9 million veterans. So where's the other half to 2/3 going? Private healthcare. The other interesting caveat is a lot of veterans are like myself in what I call hybrid healthcare, where we go to the VA for our basic overall health and wellness, go there mental health, going to see a therapist on a routine basis. It's free, so it's less expensive, or they're going in for their service connected conditions, but then for everything else, they go to private healthcare. On top of that 9 million, who some of us are hybrid healthcare, under the VA Mission Act that replaced the Veteran Choice Act, we can now be outsourced to private healthcare for a variety of reasons, whether we're requesting a second opinion, if we have to have surgery, like all of my surgeries, I've had the VA outsource me to Cleveland Clinic. If they live more than 20 miles away from a VA facility or outpatient healthcare clinic, they can be outsourced. And, or let's say a female veteran or a veteran within the LGBTQ community, they don't have a provider that can meet their needs, they can request to be outsourced. So when you really look at the numbers and you break it down, it's really probably about 4 to 5 million veterans receive all of their health care at the VA. The rest of that 9 million doing hybrid, and then there's some that don't go to the VA at all. So that's another reason why we need to open those doors and include veterans in these narratives and these discussions, because it's a misnomer that all veterans go to the VA. And a lot of times, like myself, I get frustrated because the VA didn't have the treatment options I needed, or specialists who are really up to date on my medical conditions, fibromyalgia, and another instance was with my hip and knee surgery. So I go to private care. So there's more of us receiving and utilizing private health care than actually utilizing the VA healthcare system. And that is a stereotype that I will be working on with a special video that I'm coming out on, that we have to set that proverbial chair at these discussion panels to include veterans, because more of them are receiving private healthcare than we realize in the US and other countries like the UK and Canada.
Well, I look forward to that video.
Kristal, I have a question. Yeah, me too. I have a question. Is it better care to get care at the veterans facilities versus the private sector?
Oh, that's a loaded question.
Well, the reason I ask is because I've been working in healthcare. And I know there's a lot of amazing providers, and a lot of and where I've worked, we've seen veterans, and most of them seem very happy. So that's why I asked.
So I'm going to answer this more from a medical point of view and specialty point of view. So like the VA when it comes to things like prosthetics or veterans losing their ability to see, they are top notch in those areas. There are veterans diagnosed with Gulf War illness. That is not an illness that you see commonly in the general population. And I've known several veterans who have been outsourced to private healthcare facilities because the VA says, we don't know what else to do for you. So we're going to send you up to Cleveland Clinic to their rare disease and medical conditions department. I would think that the VA would actually be the leading expert on treating Gulf War illness. The other thing is some VAs are better than other VAs. When you look at mental health and PTSD, we still have veterans dying by suicide every day, 22 a day is an average. So, you know, the other thing is veterans living with chronic pain are 4 times more likely to die by suicide than the general population. So when I look at these stats and when I look at, okay, the VA is really above par in certain areas, but as a whole, I feel that the VA is failing. And that is evident in the statistics of our veterans who are dying by suicide, veterans who are being outsourced for medical conditions that really the VA should be the expert on versus private healthcare, because our private citizens don't get conditions such as Gulf War illness. And so, yeah, it's a loaded question with a loaded answer. And, you know, there's some veterans who feel that their VA is great, but as a whole, not so much. And, you know, a great example and true example is my friend Brian Talley. He's a Marine veteran, and he was misdiagnosed for, I think, 3 or 4 months. And he went to the VA. He was misdiagnosed, and I know like some of the diagnoses he received was a back strain, and it turned out he had a real infection in his spine. And he went to the ER quite a few times, being seen, you know, at the VA, and they all missed it. And had they had caught it at the beginning, you know, he might not be where he was at. He almost died. He was immobilized. He couldn't work. He almost, I mean, he lost his business. They almost lost their house. And so when he went to file a complaint with the VA for accountability and recourse, they didn't get back to him until the 11th hour, saying like, it turned out he was treated by doctors who were privately contracted, but they wear the VA lab coats, the VA ID, they're using their VA sign-in to do their notes. And the VA didn't get back to them until the 11th hour, that they're not, because of, you know, a policy loophole, they can't be held accountable for contracted doctors. And they got back to him so late that he couldn't file like a civil lawsuit for medical malpractice. So the other thing with the VA, with a lot of specialty clinics, and I've experienced this myself with the orthopedic clinic, I was seen by 9 medical providers, and they all misdiagnosed my hip. And it turned out after 2 years and 4 months, I needed reconstructive hip surgery. Some of those providers were, you know, advanced practicing RNs in their clinical, resident doctors who were in their residency, and the department head or the doctor that was supposed to oversee their training did not come in to basically eyeball me, and they just signed off on the person's paperwork. So there's a lot of systemic issues at the VA that need to be addressed to improve healthcare. However, I will say that the VA has been really working hard, and this is another reason to bring in these discussions on the private sector. The VA has been working really hard to improve women's health and more for women and for veterans of the LGBTQ community. So, I don't want to sound like I'm bashing the VA. There are some areas that they are ahead leaps and bounds compared to private healthcare. And again, this is a reason to connect and network with veterans, because the VA has created programs for women veterans and for veterans within the LGBTQ community. And while we're seeing this discussion and slow movement in private healthcare, the VA is well ahead in those two areas compared to healthcare. So yeah, like I said, loaded question, loaded answer.
Yeah,
well, even private healthcare isn't perfect. So
no.
we have
Yeah, which is why I wanted to hear from you, because, a lot of us don't know what really happens. Obviously, I'm not a veteran. I don't know what happens in the VA system, and I only see what's in the private sector. So I think it's, it was intentional. So I want people to know and to hear from, from your perspective, what's going on, what's good and what's bad, because I think you are correct. We don't have the opportunity, or we are not given the opportunity to have a seat at the table and have these types of discussions.
Agreed. I mean, that's why it's like for Estella with the ACR,
Right.
was there any representation?
I didn't see any, and there were a lot of times where we were able as patients to attend sessions, and it would say only question, if you're a MD or a doctor, a provider, then you can ask the questions. There were some sessions that were like that, and I understand, we're not experts. We don't know the lingo, the language, maybe.
I disagree with that.
No, not all of us, not all of us, but there were a couple, and then there were others where we did have the chat area. I know I always have to say that because Melissa's like so bright, and when it comes to all the technical and also the science behind everything, but not everyone is. And I think it's good that they did allow us to go in there, and that in some sessions we were able to ask the questions in the poll section or in the chat section, but there were some that we couldn't.
Kristal, you were going to say something.
And Estella, so I had this. Okay, I'll backtrack just a little bit, and then I want to ask Estella a question if she experienced this thing I experienced with the virtual healthcare conferences. But another real quick kind of caveat and interesting point with the VA is, unlike the private sector, we can, within our insurance network, choose which doctors we want to go to. And then if we don't like a doctor, or if it's just not gelling or they're not a good fit, we can go to another doctor. At the VA, they choose your doctors for you, basically. So they'll say, this is who you're assigned to for primary care. This is who you're assigned to at the orthopedic clinic. Here's who you're assigned to in mental health. And the only way to switch doctors is you have to file a request to switch your provider with the patient representative or patient advocate. And then at that point, it doesn't mean that it's necessarily going to happen. And I've come across some situations with veterans where they're like, this doctor did this or said this, and I'm not like this, some really grievance, like it's a major, I was like, whoa, that's a patient rights violation. And they requested to be switched and they were denied. And I said, okay, we're going to put this in writing. We're going to send it via email, and we're going to copy your congressman on this, the veteran coordinator at your congressman. And so it's almost like it's not, and that's again another reason why veterans choose private healthcare, is because we have more mobility and choice of who we go see within obviously our insurance carrier. And if we go out of network, we pay a higher amount. But and that's another reason. So like for my fibromyalgia, I see private doctors because I wouldn't have to wait as long to assess treatment for my fibromyalgia in the private sector compared to the VA. And the other thing is, at the VA where I live outside Cleveland, Ohio, the doctors are just behind the times. Like they're still doing the tender point test, and it's the same story that you hear with people with fibromyalgia in general, veteran or non-veteran, is we come across a lot of doctors that tend to be dismissive or not fully educated and not into information on our condition. And we see, I see that a lot at the VA than compared to the private sector. Not saying it's not a battle either way, but it's more of a battle at the VA for my condition in my area. But Estella, so I wanted to ask you a question about healthcare conferences. So for some of the ones that I've attended virtually online, they have the opportunity where you and connect with someone, and you send them a message like, I would love to connect with you. I think, and you write like something all full of unicorns and clouds, fully like the person will reach out to you. Like one healthcare conference in particular, I requested to connect with 20 different people. 4 agreed, didn't show. And then the other 3 did connect with me, but then they said they would follow up with me via email. Only 1 person did. So I'm wondering, did you try to connect with any like healthcare companies, medical tech companies, representatives from different like pharmaceutical companies or the FDA? And if you did you get a response back?
No responses back, but I think just the fact that we're trying, they're gonna get a lot of us, and hopefully we will be getting responses. I actually, even with this last conference, I reached out and I'm hoping to get a response. I did get some emails from other people that I didn't reach out to, that reached out to us because they saw us, or they just wanted to inquire from a patient's perspective. So that was interesting. But no, not for the most part, no responses if you're trying to meet with someone directly, no.
So I think that's a takeaway for some people.
I'm going to be really bold here, and it's going to go back. I'm going to make a bold statement, and you both know me, and I have no qualms just kind of saying things as it comes. And that's like goes back to Melissa's original question about the inclusiveness of patients at conferences. But to keep it real, patients in 2020 are tokens in healthcare conferences, because we get invited and it's not always free. And then we're there, but they're not including us in the agenda. And it's tokenism. It's patient tokenism. We're there to represent, and they're like, hey, we have patients included in our conferences. They're attending and we gave them a scholarship. Yay. But there's no active outreach to get us involved. We're not being asked to present a patient perspective at this conference. We're not being asked to do a Q&A with other patients that are attending. So 90% of the time we're passive by their choice. We're passive participants, and we're just, and it's a form of tokenism. So I'm having a video coming out on that. I'll be honest, I did a couple of versions and I scrapped them because I was like, ooh, I'm too angry. I can't do this. I can't be this angry.
It's okay to be angry.
So it'll come out of it. I make sure I'm in, yeah, but I gotta make sure I'm in the space where you're not feeling the heat coming across on the video and being like, ooh, I'm scared of her. I'm definitely not inviting her again or ever.
But you know what? I do have to commend, though, the ACR, the American Rheumatology Conference, because they actually had patient perspective posters. We had presentations, and if it would have been a in live session, and we would have been in Washington D.C., both my sister and I, along with other patients, would have been on stage, which is something that has never been seen. And so I really commend them for doing that. These past 3 years, they have included patients to come in. Obviously, we need to be sponsored by a national organization in order to attend, but I thought that was pretty incredible. And I hope that other conferences and other, big conferences and from like the Department of Health and everyone else includes more of the patients' voices. I know for myself, I'm going to be going to the Datapalooza and and a couple of other conferences for and I was able to get the scholarship. So I'm really excited about that, and I'm just hoping that I see more patient presentations. I know last year for the Datapalooza, there were some patients on stage, even on the main stage, which was pretty impressive. So I just commend all those that are engaging the patients, including them, and also giving them a spot and to speak.
Well, and so please not be afraid of us.
Like I said, I'm not at all healthcare conferences. I know that the ACR did a tremendous job. They actually also included patients from Canada and one person from the UK. So, they're really innovative in leading the way, and so is Datapalooza. But again, Datapalooza is really patient driven, and that's why we see so many patient perspectives reflected. And I would love that it would be awesome is after the fact that they posted these conferences on mainstream media so that people and organizations can look and be like, well, look at that. It is possible. And this is important. And they are the experts. And that's like I said, talking about patient tokenism, I'm not saying not everybody is doing that, just having their to be there, to be like, we believe in including patients and their voices, and we're letting them attend our conference, but they can't say anything. It's I don't know, that's a double standard. I'm kind of like, and I also feel, in light of everything that's gone on in 2020, that there's some last minute invites I've received to go to virtual conferences, and I know because they want to promote as if they're promoting inclusiveness of patients. And I'm just like, yeah, I applied to attend this conference like 6 months ago and applied for a patient scholarship, and I got turned down when they were going to have in person before COVID shut everything down. But now that you're doing virtually, you're inviting me last minute, like 3 weeks before the conference goes live virtually. And I've had that happen with 3 different ones. And I just, I'll be honest, it doesn't sit well with me. I'm like, well, I wasn't important enough, like when I applied, like, I don't know, 10 months ago, but now I am 3 weeks out, probably because patients dropped out and said, I can't, it's a conflict. And so I was the B-lister.
Oh,
but again, it's just one of those things healthcare can't just, healthcare organizations and healthcare as a whole can't say we need to include patients. They need to have actively involved.
Definitely. That's one thing that I have been saying. You can't have, a patient-centered healthcare without the patients being included, and you can't have better healthcare outcomes if we are not part of the care team. So I agree with you 100% on that.
One of the things I wanted to share, because I get excited about, so bringing. Oh, go ahead, Kristal. There's a delay. Oh, I hate the delay.
You're so cute. Like, I got so excited.
Well, I wanted to talk about advocacy, your advocacy work for veterans' voices for fibromyalgia, because and I think people are understanding now the overlap with working with LUMS for lupus, because they did a lot of advocacy work for lupus, going to Capitol Hill. And so joining us with fibromyalgia and sharing, Juana, she couldn't join us today, but she's a peer reviewer for the DoD for the lupus work. So I'm just really fascinated by what lupus has done on a legislative level, and then trying to see what we can learn from. And sort of do for fibromyalgia as well. So that's why I'm excited to have, Estella and Kristal here to have this conversation. I know this is probably have to do a part 2 eventually, but can we talk a little bit about the advocacy work that you're working on, Kristal, and then maybe bring in some discussion with how lupus has done and all that from Estella's side?
Sure thing. I'll try to make it fun because it's really boring. I try to break everything down. But as far as the veteran side goes, yes, I brought it up before the Tally Bell. That Brian Talley's story came across my radar about 3.5 years ago. And I threw everything and I just was like, oh my goodness. I'm like, this is probably, I mean, I come across some extreme cases that happens with veterans, but this is probably going to be my top 10 in a lifetime. And I just reached out to him and I was like, I'm going to help you. And, someone says I'm going to help you. It's always, a lot of people say that. And I said, I don't expect you to believe me, and because actions speak louder than words. When it comes to legislative advocacy, a lot of people, it's hard work. So, I mean, you have to be really determined. It's not, you can't bring about change overnight. It could take years. Brian Talley's case, it's going on 5 years. And there's a lot of steps. And so, yes, I support and I do help Brian with what he needs from me to promote and support the passage of the Tally Bill. In July, ironically, I was listening to, and just for people who don't know, on Facebook, your congressional committee meetings, floor meetings, whatnot, a lot of times they will stream them live on Facebook, or they're posting the video on their website so you can go and watch it. So in July, I was watching, it was the Congressional VA Committee Majority, and they were, Representative Levine was presenting the Tally Bill to the Congressional VA Committee that day. And so I'm watching. I was like, because I wanted to see how he presented it and how the committee responded. So, and it went well. And then I'm like, okay, well, the next session is going to be about issues that females incur accessing VA facilities and like harassment and assault. And so I was like, I'm going to look at this. And I got so livid listening. So, the VA did its own study, and they found that 1 out of 4 females, veterans, and also female staff at the VA are experiencing some form of sexual harassment, sexual inappropriate behavior towards them, or assault. 1 out of 4. And the response from the VA was, at this hearing, was that they're not going to be able to put anything in place until 2024 as far as policy changes, training, and addressing this issue. And I'm like, what? You're telling me it's going to take you 4 years to draft a policy and put some educational training and an HR piece together? What happens if you're caught, as an employee harassing a female? And there's the other piece too, that, females can be on the receiving end of this harassment from male veterans as well. I just thought that was that's just not appropriate timeline. Like, this is something that needs to be considered, having some urgency behind it. The VA gets $200 billion a year. And so I was like, okay, I'm one person. I'm already working on some other policy and legislative stuff. I started reaching out to big organizations who create a lot of legislative bills or advocate. And I reached out to a bunch. And finally, the Disabled American Veterans came out with a legislative bill to address and hold the VA more accountable and make it an urgency to protect female veterans and female staff at the VA. And I was involved with creating that bill, but as a female veteran, I reached out to my district congressional leader, our state congressional leader, and I got that bill all the way up to this, state of representatives in Ohio. And that's the key is relation. So people ask me, how do you start doing legislative and policy advocacy? Like, you got to build relationships. When you're looking at legislative policy, a lot of people go to DC to understand how our system works to put a legislative bill together, to get it passed, and all the steps it goes through. And that's, I'm like, and really you should understand those steps before going, because when you present your story, it will be more impactful. So I always tell people, go back to the basics and establish and create relationships with your district representatives and state representatives in Congress, because they're going to be the first step for if you do any legislative bill. And some of it is just call in and schedule a meeting. And people are like, I can't do that. I'm like, why? They're serving us. They're civil service. They're just like us. Start with your district congressional leader. They live in your neighborhood. Go to events that you know that they're going to, and create those relationships. And then you start establishing those relationships. Follow their pages on social media. Send them a friend request. Some of them will accept it. Some of them have for me. That's the key. That's the key to starting a legislative and policy advocacy, is building relationships. Then you got to build a team. And it can't just be a team of, we want to do this. You really want to have some key players that understand policy, legislation. You might want to have a team player that's really good on social media, like blitzkrieging on social media to promote awareness for whatever legislative or policy piece that you're advocating for. You really need to treat legislative and policy advocacy as a business, and having to bring on people to fill roles within that team so that you have something well-rounded. It doesn't mean you need 50 people, 10 people is good. And as you get more momentum, you can bring on more people, and you're going to find towards the end, when you're working on something like a legislative bill, all of a sudden you have more people jumping on the bandwagon. That's fine. Let them join in. They might be more proactive the next piece that you work on. A lot of times with legislative bills, if you don't know how to draft a bill, you either got to teach and it's hard, or you got to hopefully find an attorney who is legislative, who will donate their time pro bono to help you draft a bill. And if you can't, then you got to pay an attorney. Once you get a bill draft, you want to go to your district. Sorry, I had something weird pop up there. That's when you want to start those relationships that you built with your congressional district leaders and state leaders. Once you have that bill draft, that's when you start going to them and saying, hey, remember when I talked to you about ABC and, XYZ? Well, here it is. And remember how we talked about how you felt, and you used their words in the previous conversation where you said this was an important issue, and I felt the same. So I decided to be proactive and try to get a bill together. Now, you don't have to do that step if you have a congressional leader who's willing to do it. Like if it's something they're very passionate about. When you're advocating, though, your story is very important with legislative and policy advocacy. People that you have 2 minutes to make it or break it. And you want to include your personal story, but also some caveats that are going to really hit that moral, emotional button. So an example would be you go to DC or you go to your Congress leader and you say, we really need more funding for fibromyalgia. And here's the reason why. By 2030, there's going to be just as many people in the world with fibromyalgia as diabetes. Out of the top 10 reasons why someone might die by suicide, chronic illness and chronic pain is number 5. In fact, the University of Copenhagen in Denmark found individuals with fibromyalgia were 8 to 10 times more likely to die by suicide, and they were not who were diagnosed with fibromyalgia. And that when they looked at suicide rates amongst those with fibromyalgia, none of those patients had been diagnosed with a pre-existing mental health condition prior to the onset of their fibromyalgia. In the United States, we have 10 million people with fibromyalgia. And the other thing is veterans with fibromyalgia. We have almost 20 million veterans, which means 2 to 4% of our military veterans have fibromyalgia as well. And we know that the stats for, suicide rates amongst the fibromyalgia community is alarming high. And then when you look at veterans, and you compound that with PTSD and chronic pain, that puts them at an even higher risk. So this isn't just a matter of feel good, let's create a treatment or put more funding. This funding is needed because save lives. We will help reduce suicide risk amongst the fibromyalgia and veteran communities. Fibromyalgia is one of the least funded medical conditions, but yet it's prevalent in the world at high rates, so it makes no sense. And then you tell a little part of your personal story and how your life is living with your medical condition, whether it's lupus or fibromyalgia, along with say, end it with what the positive impact more funding for research or treatment would have on your life. And so it's relationships, and it's also being able to tell a concise story with important facts in a moral, emotional way of conviction. Because at the end of the day, these leaders, they're people too. They know someone touched by some type of illness. It might not be fibromyalgia, it might be cancer, it might be heart disease, but at the end of the day, they're just like us. And finding that connection and being able to do it within a short amount of time makes a huge difference on whether you're going to be able to steam forward ahead with legislacy or go back to the drawing board and start over and work your way with another congressional leader. So getting it the first time around, it's very stressful and you worry, but if you nail it, you open a lot of doors. And the other thing is when you go to Washington, D.C., if you've already met or spoken with your state's leaders, when you're working the halls, you've at least connected with them before. So you're not they're not going to remember if I had a conversation with you one time, but if you keep that date and say, oh, I'm so glad to meet you in person. We spent this date and it's an honor to interface with you today. And thank you for taking the time. Because then you're going back to and promoting that you established a relationship with them. They won't remember. And I tell people don't do it by email because their staffers answer those. So
yeah,
that's where you start with legislative is
exactly
relationships, connections.
Yeah. And, I think I agree with everything that you said. I think the relationships are very, very important. That's the one thing that I say is let's connect with our legislators. They work for us and with us, and, making sure that we have that elevator speech or that 2 to 3 minute speech to be able to impact them when we're sharing our story. And totally agree with you when it comes to talking to them and connecting at a different level, in a more human as possible, because they are people just like us. And not to be intimidated when you're talking to them, because they also may be or may have loved ones with illnesses as well. And that's one of the things why I love our legislators so much. And our Congresswoman, Grace Napolitano, not only is she a huge mental health advocate, we're part of the consortium, but she also is very, very involved with uplifting and supporting the veterans. She had we had a special meeting just for veterans on Wednesday, so it was really, really amazing to see that. And when you see that your person is actually so engaged and with the community, that just gives you such motivator to continue to work with them. And you're right when it comes to legislative bills and all of that. You don't always have to pay for it. A lot of the times, if your legislators do believe in what you're talking about and want to help, they will then have everyone, on their team work on these bills for you. And finally, one of the things that you were talking about was the emailing. I actually love the fact that if we email, that the staffers are the ones that answer, because a lot of the time the staffers are the ones that kind of lead the legislators into what they think it should be done. So building relationships also with the staffers is huge. So don't give up on sending those emails, but obviously it would be better to send them directly to a legislator. But the staffers are key, and those policy staffers are
Right.
amazing as well.
And I do agree with that.
Well, I'm ready to go to Capitol Hill.
Yeah, I also do emails as a way to track things, but I also think it depends on your legislators' staffing teams. So some are great, and again, a lot of people just rely on the email, and I'm saying don't just rely on that email, because you just, some of them are great, and some of them, and I've experienced both. And I'm like, just one part, like, don't stop there. Don't just rely on the email. I like the email because I can basically have a document trail. And I did that with the tally bill a lot with my state's legislators, but other states as well. Because I always tell people, yeah, go ahead and call Senator Cruz. I know you don't live in Texas, but leave him a voicemail asking them, say you're, like, for the tally bill, say you're a veteran and you support this. And by supporting this bill and its passage, you're protecting my rights as a veteran and allowing me the right to due process as well. And I do it all the time. And that's the other thing, is people say, only call your senators, only call your congressional leaders. And then there's me all day on the phone for 2 days. I'm calling all 50. But yeah, I don't want to sound like I'm like dismissing the staffers, but the other thing is, don't fully rely on the staffers. Like, you can springboard from that, and you can say, oh yeah, I also reached out and by email, and your staffer John Doe responded, and yada yada. And again, it as you know, it doesn't even matter. Every field, the quality of work someone does it varies person to person. So you can work in business, and there's some business secretaries who are fantastic, and some not so much. So, but that's another
Definitely.
point. I have told a couple of congressional, I was like, your one veteran coordinator is always MIA, doesn't respond to emails. Like, this is an issue, especially when there's an email out there that was sent to them about a major healthcare patient rights violation. Like, they should be responding. So you take it as a grain of salt. And then sometimes you email a different representative who might not represent you directly, but I've done that as well.
It's not giving up, right? And just continuing to push on, follow up on emails with phone calls, and to ensure that you are heard.
Exactly. I know we're coming up to the hour, and we could probably continue this conversation forever. I'm so sorry. There's such a delay on me. So, Kristal, did you want to add something before we close out?
Oh, I was just going to say, for anybody watching now or watch the playback, Stella and Juana are really great to follow, because they're really the epitome of doing it all with legislative advocacy, and they show it. It's like they're doing it on the local level, the state and the federal, and they're using all the caveats and all the possibilities to get what is needed for the community on a legislative level. For me, I don't really talk about it as much in regular communities, but Looms for Lupus is a great example of what to follow as far as legislative and policy advocacy. They're out there posting it.
Thank you. I think one of the things that we wanted to do from the get-go and was the fact to, not just support the community, but also empower them and letting them know that they too have a voice, not just here at the local community, but they have the power to change things and to change how healthcare and access to healthcare is given to us. And, just to have the best support, mainly, for our community. So that's why we do it. So thank you.
Well, it's been
And
great.
we'll start in the future.
Well, I'm gonna probably let Estella close us out since I'm on such a delay. So, Estella, you want to close us out and talk about? There's a couple events happening tomorrow. I really want to bring Kristal back in for the impact tour, talking about VA health as well. So we'll be back, but I'm gonna let the other ladies close us out since I'm on such a delay.
Yeah. So yes, we have a couple of announcements. So we have the iPain Summit, which is virtual tomorrow. I do want to give out a couple of scholarships if you guys are interested in living with pain and want to attend. Please let me know. You can send me a private message because I know it's like $65. I will be one of the hosts, and I will also be presenting. This is the first time that they're going to have actually 2 presentations in Spanish. I will be presenting on continuing to live with pain and not losing hope. And, so I'm pretty excited to do that. Again, there's going to be amazing speakers, all dealing with, pain and living with pain and just all kinds of great information. So please let me know if you are interested in attending. I do have a couple of seats that I can give out. And then I think we lost Kristal. I don't know what happened, but so please join us. Also, we have a support group tomorrow. Looms for Lupus has their support group virtually. So if you want information in regards to the support group, please email kmcmahon@lupusla.org or info@loomsforlupus. We will have the Spanish support group that will be live on Sunday instead of Saturday because our schedules are super packed. So we're just hoping that you guys can join us. And we have the amazing speaker from a patient engagement liaison, Alice, that's going to be joining us in our support group tomorrow, speaking on the Us and Lupus website, as well as Ruth Padilla-King, the licensed clinical social worker, who will also be on the Lupus LA website today at 2 p.m. She attends our support group, and she's going to be talking about, oh my gosh, I forgot I forgot the topic. It's something about grievance. I forgot the word.
Gratefulness and yeah. Oh, Kristal, we need you to turn your camera so I can add you back in.
Yeah.
Can she hear us?
I saw her disappear and come back. So I don't know if she can hear us. But those are the announcements that we have.
Oh, Kristal, you're here through
my
audio.
My camera is on. And let me reboot this.
Well, we can hear you still if you want to just say some. I think you have to turn your camera.
I shifted. We'll all go like
Friday
this.
the 13th, everyone. This is what I was wondering.
There you go.
I don't know what happened. We've had the internet company. Our internet's been funky on my end. The internet company's been out like all week, and I think that they hit something.
Yeah, well, thank you so much, Kristal, for joining us. I'm sure we're going to do this again. I know we've had a couple of delays. Maybe it's Friday the 13th. Maybe it's just our technical difficulties. But, thank you for joining us. And just if you want to say, your last message for today, and then hopefully we'll have you come back again. I don't know.
Last message. You know what? Don't ever underestimate what you can accomplish despite your illness. Whether it's promoting awareness, education, doing policy or legislative advocacy, you can actually do a lot from home virtually. And with COVID, we found that it's very plausible. Don't ever underestimate your voice when sharing your story with any platform, whether it's a healthcare conference, whether it's with your community, your doctor, or policymakers and legislative branches. And the other thing is, look for those individuals who vibe with you, so that when you want to collaborate and support each other, you create your own tribe of basically cheerleaders and support system to help you through the lulls of advocacy and awareness, because there's going to be some downward hill slides at times. It's not easy. We all smile. We're all like, go team, and we can do this. And yes, we can, but there's difficult days. So don't let that become your defining moment. You can push through, and you just need to accept that we have to go through those ups and downs, because we will learn and be better in the long run, and not to give up. And always make your self-care your number one priority, and love yourselves and love each other. Those are my closing words.
Thank you. And thank you for your service. And thank you to all the veterans that are watching, and all the veterans that have been in active duty, that have lost their lives, and that continue to serve. And again, thank you. Thank you, Melissa, for putting all this together. Thank you, Kristal, for sharing that. And let's continue to advocate and empower and support each other, and always uplift each other. Have a wonderful, wonderful weekend.
Bye.